Hi Tanya, my name is Laura. I'm a student nurse today. I was wondering if you can give me a report on your patient, Mr. Jarvis.
Yes, I can. How are you, Laura?
I'm good, thanks.
Great. Mr. Ronald Jarvis is in room 622. He's a male, 67. He's a full code. He has no unknown allergies. He's being treated by Dr. Phillips. He's alert and oriented by ×3. He is here primarily because he has a stage 2 diabetic ulcer on the right heel, and he's hyperglycemic. In the past 5 days, he has not been able to keep his sugar level below 300, and his heel has been, it's not healing. He's tried foot soaks, salt soaks, and they're not working. He has some tingling in the peripheral areas, and that has worsened over the last 3 months. His lungs are clear. His heart sounds are normal with no signs of murmurs or gallops. He has a normal sinus rhythm. All the pulses, including his pedal pulses, are palpable. He voids on his own. His abdomen is flat and soft. There's bowel sounds in all 4 quadrants. He has a right forearm IV that was put in on Tuesday. He came in with his vitals, his blood pressure 140/72, temp 98.4, heart rate 80, O2 of 95. It has his blood pressure has decreased since and now is 128/70. We're giving him 2 insulin shots today. One is Lantus, which is a long-acting insulin, and a regular insulin, which is a short-acting. And also, if he has any pain, we're going to give him some morphine. His labs, he has a decrease in calcium, and it's currently at 7.4. His A1C is in the fair diabetic control area, and he has increased liver enzymes. So some of the things that we're going to do with him today is we're going to, we've consulted the wound care team already. We're going to educate him on his diet and also educate him on his insulin, and yeah, basically. Oh, I did forget to tell you that we did do a blood glucose of 242 at 20/30. Did you have any questions?
Yes. Why specifically is this client receiving that medication?
Because he's a type 1 diabetic.
And what action does the medication have on the body?
It metabolizes, it goes inside the cell, opens the door for glucose to go inside the cell and metabolize in the skeleton.
And when should you question administering this medication?
I would question it if it was below 70, his blood glucose, if he had any signs of sweating or dry mouth or anything like that.
And does the medication have a therapeutic serum level?
No.
What vital signs must be monitored?
His blood glucose as well as his heart.
And which physiological
Blood pressure.
Which physiological parameters should be monitored when the medication is being administered?
Hypoglycemia as well as anaphylactic measures.
And what interventions must be taught to the client to ensure the medication is administered safely in the hospital and home setting?
In the hospital setting, we want to make sure that he's eating and ordering his meals, as well as we're making sure that we're rotating sites. The same at home. And in addition at home, how to store the insulin, as well as how to make sure he can check his glucose level.
Okay. And what are the side effects and potential adverse reactions of this medication?
It would be hypoglycemic as well as anaphylactic.
And how do you know when the medication is effective?
His blood glucose would actually decrease.
Okay, I don't have any further questions, but I was wondering if I could follow and watch you give your insulin to
Sure,
the
Miss
patient.
Alice, it's okay with him, absolutely.
Hello,
Hello, Mr. Jarvis, how are you?
I'm well.
I'm Tanya, I'm your nurse today. I have Laura, the student nurse. Is it okay that she stays?
Of course.
Okay.
Okay.
I'm gonna wash my hands.
No, I pretty much got it.
Okay, I also want to go over the diet. It
Name,
looks
date of
like we
birth?
have you
Ronald
on,
Jarvis, and
you're supposed to be
67
eating
years
about
old.
1,800 calories a
That
day.
is you.
Looks like your
And
sugar's
it says it
high.
right here on the
Have you
screen
been
as well.
cheating on that diet?
So, did you
Not really.
Okay.
eat tonight?
I did.
Snaps.
Okay.
How long ago?
Okay, if you want
Just
to
about
go
10
over some
minutes or so.
teaching, I
Okay,
can
that's
offer you some
awesome, that's great.
education.
I'm here today because there's two insulins that we have to give you. One is your bedtime insulin, and that is Lantus, which you get that every night at bedtime. And then the other one is a long, short-acting
Thank you. You have a
insulin.
nice day.
And since you already ate, we can give it to you
Were there any pertinent
right
pieces of
now.
information you reviewed before
And,
administering the medication?
Yes, with Mr. Leeds, I wanted to make
Perfect.
sure.
And the reason why we're giving you short-acting, your blood glucose was 242.
Okay.
Do you have any, it says here that you have no known allergies.
No, I do not.
Okay, perfect. So I'm gonna go ahead.
Did this information affect your decision to administer the medication?
It did, it looks like his sugar was about 242, so.
Pull everything up
Based
here
on the
for
doctor's
you.
orders, that led me to, administer the medication.
Did this information
So what did
affect
you have
how
for dinner?
you administered
I
the
had some
medication?
chicken and broccoli
I wanna say no.
Where did they give you your insulin
Thank you.
last time at?
in my belly, man. On
Okay,
the right side.
on the right side?
Jackie, how you do that?
I don't know anything.
Jackie, you told me
Did
how
you
many
happen
times,
to
what's
have
the
any
order for the medication?
information on how I can
Yes, I do. You know
do
what?
my diet at home?
Yes, I do. I do have two. And I'm gonna put those right on top so I don't forget, and we'll go over a few of the things,
Okay,
okay?
good. Thank you so much.
Thank you. Brad, and Jackie, if it's 10 and 10, draw back 20. Push 10, push 10 in the other one.
I did want to check before I open that. I did want to check everything. This is your Alanis. You're getting 18
Yes, I did, don't
units.
do that. It's just, it's 2
So
hours.
Q.
Because me and
The
Tony
right
talked.
time right now, which is 2200, 10.
No, because me and her, I was asking her,
How they take the insulin is with food, with meal. Like, are you gonna get your breakfast in?
they AccuCheck AC and HS. Like, we know that.
You know about they take it with the meal, like they gotta eat too.
You take it before.
They take it
That's what they
30
said
minutes
about
before.
You just have to take it before.
I need to get my supervisor.
I don't want to do anything.
Okay.
I say you take it every 4 hours AC and HS. That means before and after a meal. I don't know, maybe you say that. I got proof.
I know I said AC and HS.
So I have this one for you. This is the one you get at bedtime.
What you want me to see?
Okay? And then I'm gonna check it
So you tell
again.
you know,
The expiration date is good.
Right here, they gotta clean this up. That's their job.
Guess the chart.
Hey, this your script?
Hi, Dr. Arfit. This bottom one is no longer green.
You gotta be what you sure your time, 2100, 2211. So that's what the problem is.
Okay.
It's not gonna let you get it because it's too far past.
I know, but when he gonna download it too?
You're on camera, hon. Smile.
Sorry.
No breaks, right?
As soon as she started doing it, I was about to say, man, cut the tape.
So go into a different practice one. Because you had gone past time on that one.
Okay. Thank you.
No problem.
Sorry, cleaning up yet.
That's okay, it'll come out of your next test. Jackie's like, no, 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 can't do that.
Okay, I'm gonna wash my hands again.
It's a cold one. Then what do you wanna do? Don't say that.
Okay, like I said, I went ahead and verified that particular one, right dose, right time, right person, right measures. Then I'm gonna go with the regular insulin. It's given subcutaneously, which we're gonna put in your belly at 2100. And it's the right dose. There's no expiration.
Alright, guys. This is somebody's. I don't know who this is. I don't know if you guys needed it. Bye, guys.
Okay, we're gonna give them subcutaneous. We are gonna do 16 units. I'm sorry, I'm gonna pull some air back here. And 16 units. And we're gonna do 18. So the regular. One cap method. Okay, you said that.
I had it on the right side.
Okay, so I'm gonna do it on the left here. And this is your regular.
Okay.
Move it over. Okay. Then we're going to document that we just did it. Oh, I forgot to.
Was there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I looked at the glucose levels as well as looked at the vital signs.
And did that affect your decision to administer the medication?
No.
And did this information affect how you administered the medication?
Yes, it did, because I had to look at what the sliding scale was.
Is it okay if I watch you document?
Yes.